Good evening, I'm student clinician Tyrone Byrne. Today I'm going to show off some projections including forearm, elbow, and humerus. So we're going to start out with two forearm projections. First is going to be AP forearm, and I'm utilizing my right arm here as the affected arm. The SID is going to be 40, and we're using a 14x17 cassette. Since it's the right arm, I want to put down my right marker. And what we're looking at is a central ray that's going to be perpendicular to the midpoint of the forearm. The anatomy we're looking at is going to include the radius ulna, distal humerus, proximal row of carpal bones, and we're going to actually collimate down to include the elbow joint, as well as the wrist joint. Next view is going to be a lateral forearm. We're going to shift the patient so that the elbow is flexed 90 degrees. Again, we're using 40 SID. The cassette is 14x17. The central ray, again, is perpendicular to the midpoint of the film space and mid-forearm. Anatomy is going to include the radius ulna, distal humerus, as well as the proximal row of carpal bones. And just to note, the epicondyles are actually going to be perpendicular to the image receptor. Marker is in place. And for both these views, we're going to instruct the patient to don't breathe, don't move, and we're going to include shielding on their lap to protect from radiation. Next view is going to be AP elbow. Again, the affected arm is going to be the right arm here. And we're going to have the patient actually extend their arm. Place the right marker down. Again, the SID is 40. The cassette we're using is a 10x12 cassette. The central ray is actually going to be perpendicular to the elbow joint. What we're looking for here is the elbow joint, distal end of humerus, proximal end of radius and ulna, and our epicondyles are actually going to be parallel to the image receptor. We're going to instruct the patient to don't breathe, don't move, and we're going to include shielding to protect from radiation. Next is our medial, oblique, or internal projection of the elbow. So we're going to ask the patient to actually rotate the elbow. We're going to bring it prone in this manner here. Again, the SID is 40. The cassette we're using is a 10x12 cassette. The central ray is going to be perpendicular to the elbow joint through the center of the film. So we would actually move the patient's elbow into view, perpendicular to the elbow joint through the center of the film space, and we're looking at elbow joint, distal humerus, proximal forearm, and the coronoid process of the ulna. Now when we get to the next view, it's going to be, and we'll instruct the patient, don't breathe, don't move, include shielding to protect from radiation. Next is going to be the lateral oblique or external view, or external projection. We're gonna have the patient rotate the hand, or rotate the arm, so that the first and second fingers are touching the image receptor. Again, we're utilizing 40 SID cassette, 10x12. The patient's arm should be in a supine position. Central ray is going to be midpoint of the elbow joint, and the anatomy displayed, elbow, radial head, and the neck and tuberosity. Again, we're going to ask the patient to don't breathe, don't move, and include shielding to protect from radiation. Next is our lateral elbow. We're going to have the patient flex the elbow 90 degrees. SID is 40, cassette 10x12. The central ray is actually going to be midpoint of the elbow joint through the center of the film space, The epicondyles in this case are going to be perpendicular to the image receptor, and we're looking at the distal humerus, proximal forearm, olecranon process. The image can also include the fat pads. Next, we're going to look at a couple special views. First is going to be the Jones view. So in this case, the patient will fully flex the elbow, place the hand on the shoulder. Again, the SID is 40, cassette we're using is 10 by 12. Now the central ray is actually going to be about 2 inches superior to the olecranon process. And here we're looking at the forearm and humerus, which should be superimposed in the image, olecranon process, any soft tissue structures, as well as the distal humerus. The next one is going to be an acute flexion of the ulnar sulcus. We're going to have the patient flex 90 degrees, and the forearm hand should be in a supine position. SID is 40, cassette 10 by 12. Central ray is going to be perpendicular to the humerus, approximately 2 inches superior to the olecranon process through the center of the receptor space. So it's going to be back here. Anatomy should include the forearm humerus, which again be superimposed, olecranon process, soft tissues, and distal humerus. Our next view is going to be the Holly distal humerus view. So, patient should have the arm in a supine position. Now, this view is going to be partially flexed. So, in this case, you would probably have a sponge, have the patient rest, because in these special projections, the arm is compromised in some matter. So again, we're using 40 SID, cassette is 10 by 12. Central ray should be perpendicular through the elbow, and we're looking at the distal humerus. And this would be the Holly distal humerus view. Now the Holly partial extension view, or proximal radius ulnar view, will have the patient trying to partially extend. However, they won't be able to because they're in a compromised position, so they'll most likely kind of stand and have the elbow in supine position, maybe a little sponge here. Again, 40 SID, cassette 10 by 12, central ray is perpendicular to the elbow, and we're looking at the proximal radius and ulna. Coil lateral view, which we'll be looking at the radial head and the capitulum as our next projection. So you're gonna have the patient flex the elbow 90 degrees. 40 SID, cassette is 8 by 10. Now, central ray is gonna be 45 degrees toward the shoulder in order to capture the radial head and capitulum. So the central ray is going to come this direction here to capture the radial head. Now the coil lateral projection, which is for the coronoid process and trochlea, still going to have 40 SID. Cassette is still going to be 8 by 10. But this one, the central ray is going to come away from the shoulder down this way to the elbow joint for the coronoid process and trochlea, and the anatomy obviously is the coronoid process. With these special views, again, you're going to ask the patient to don't move, don't breathe, or don't breathe, don't move. You're going to have shielding to protect from radiation. All right, last is going to be our humeral views. So let me adjust the camera. All right, so the first view here is going to be the AP humerus, 40 SID, and the bucky is going to be, we're going to act like the bucky's behind me. So the bucky will be back here. We're going to use 40 SID back against the bucky. The AP humerus view, 40 SID cassette is a 14 by 17. Central ray, you're going to ask the patient to extend the arm. Central ray is going to be perpendicular to the midpoint, perpendicular to the image receptor, about midpoint of the humerus. The anatomy we're looking at here obviously is the humerus. Now your epicondyles are going to be perpendicular, the epicondyles will be parallel to the image receptor, and you'll want to put some type of shielding to protect any breast tissue. Next view is going to be the lateral humerus. It's going to be internal shoulder rotation. So you're going to ask the patient to internally rotate. 40 SID cassette again is 14 by 17. Central ray is going to be perpendicular to the image receptor, mid-humerus. Epicondyles in this case are going to be perpendicular to the image receptor. Again, we're looking at humerus, and we're going to provide shielding to protect breast tissue. The last image is going to be lateral humerus. It's going to be external rotation, external shoulder rotation. It's going to also be known as the hitchhiker view. So in this case, I'm going to just kind of adjust here. And again, Bucky's behind. Patient's going to have the back against the Bucky. It's going to be 40 SID. It's a 14 by 17 cassette. The way this motion is, it's going to be kind of a flexed motion here, 90 degrees. You're going to have the palm facing the patient, but the thumb extended posterior. So it'll be like this. And again, this is 40 SID, 14 by 17 cassette. Central ray is going to be perpendicular to the image receptor, mid-humerus, and we're going to provide shielding to protect from radiation. One thing to note though, you'll never want to do this image if you suspect that the patient has a fracture or some type of dislocation. All right, that will conclude projections for the forearm, elbow, and humerus. Again, we'll provide shielding to protect from radiation in all these projections. We'll ask the patient to don't breathe, don't move, and that's going to conclude the video. Thank you. Have a good night.